Trauma Patient Assessment and Management Station is designed to test an EMT intermediate or paramedic candidate's ability to systematically examine a patient with trauma to multiple body systems and to appropriately manage the conditions found. Candidates can assume there are up to 2 assisting EMS providers that will carry out the treatments that are verbalized. Candidates have 10 minutes to complete the station.
In this station, the examiner will provide specific clinical information not obtainable by visual or physical assessment of the patient. Conduct your trauma assessment as you would in the field while communicating with your partners. State exactly what you are assessing and what care you are providing as you perform the skills. This way, the examiner sees and hears you complete the skill. Most errors at this station occur because the candidate focuses on assessment but fails to appropriately manage serious conditions as they are discovered.
Candidates at this station will have equipment and supplies necessary to assess and manage a patient with simulated injuries. Equipment and supplies for assessing the patient can include a trauma kit with stethoscope, BP cuff and pen light, and medical exam gloves as part of the necessary personal protective equipment. Equipment and supplies for treating the patient's condition may include items such as trauma and occlusive dressings and bandages, supplemental oxygen, and a blanket. The patient may be wearing tearaway clothing to enable the candidate to expose, examine, and treat an area of the body. The trauma patient will be moulaged using items such as fake blood or prosthetic devices to depict the desired injuries. The main sections of the Trauma Assessment and Management Station involve BSI precautions and scene size-up, initial assessment and resuscitation, focused history and physical exam or rapid trauma assessment, detailed physical exam, and managing the primary and secondary injuries appropriately.
Welcome to the Trauma Patient Assessment Station. You've had an opportunity to check your equipment. Do you have any questions for me at this time?
No, ma'am.
Okay, we'll start this station. You're called to the local community center for gunshots fired with an adult male hit.
Okay. At this time, I'm going to take my BSI.
Okay.
Is the scene safe?
Yes, it is.
Okay. It appears that I have one patient. Are there any more patients for me?
No, just one.
All right. Mechanism of injury, I should assume, is a gunshot wound. And I will consider additional resources right now, but I'm not going to call just yet. All right. And I'm going to go ahead and take C-spine on my patient. Sir, can you hear me? Do you know what happened?
Someone shot me.
Someone shot you? Okay, my patient is alert and oriented. I'm going to go ahead and pass C-spine off to my partner. All right, my patient does have an airway and he's breathing, and his breathing appears to be rapid at this time. I'm going to place him on 15 liters of oxygen via non-rebreather.
Okay, I understand you're putting him on oxygen. You can turn it off from this point on and simulate it.
All right, I'm going to go ahead and check for circulation at this time in the carotid and the radial.
Pulses are weak and rapid.
Okay, and I'm going to go ahead and check for some major bleeding. I'm going to go ahead and expose my patient. All right. Oh, I do see some bleeding on his chest. It does not appear to be major, so I'm going to note it and continue on. All right. I did not find any other major bleeding. I'm going to go ahead and treat the bleeding on the chest, treat for shock, and at this time I do believe my patient needs rapid transport to a trauma facility. Okay, at this time I'm going to start my rapid trauma assessment and treat any major life-threatening injuries. I'm going to go ahead and treat what I believe to be a sucking chest wound. I'm going to have my partner place his gloved hand over it while I get my occlusive dressing. Okay, at this time I'm going to start my rapid trauma assessment at the head. I'm going to check for any crepitus. All right, checking the neck, looking at the neck for any tracheal deviation or JVD. At this time I'm going to have my partner place a C-collar on him. Checking the shoulders, looking at the sternum, checking all the ribs, checking for any paradoxical motion or any crepitus. I'm also going to listen for a set of lung sounds. The lung sounds are present in all 4 quadrants and clear and equal bilaterally. I'm going to check the abdomen for any rigidity or distension, any tenderness or guarding. In the pelvis, checking to make sure it's intact and there's no crepitus. I'm going to expose my patient's legs at this time. I'm going to check for any decap BTLS on my patient's legs. Check his PMS. Pulses are present. Sir, can you push down on my hands? Can you pull up? Good. What toe am I touching?
Big toe.
Wiggle them for me. Just wiggle your toes. There you go. PMS is present on the feet. Going to check his arms for any decap BTLS. Checking his PMS. His pulses are present. Squeeze my fingers. Good. What finger am I touching?
Index.
Okay, good. Wiggle them for me. Good job. Okay, his PMS is present in his hands. At this time, I'm going to use my 2 partners' assistants to log roll him, check his back, and place him on a backboard. Okay. On the head's count, 1, 2, 3. All right, I'm going to check his back for any exit wounds, checking the back of his head and neck again, checking down his spine and the back of his ribs and the back of his legs for any decap BTLS. Place the backboard and roll him back onto with my partner's assistance, and at the head's count, ready, 1, 2, 3. Okay, we'll go ahead and secure him to the backboard and get him in the back of the unit. At this time, I will have my partner obtain a baseline set of vitals, and I'll go ahead and begin my sample history. What are my baseline set of vitals?
Respirations are 24 and shallow. Pulse is 114, weak and regular. Skin is pale, cool, and moist. Pupils are equal, slow to react. And blood pressure is 108/72.
Okay, I'll go ahead and place him on the cardiac monitor, establish 2 large bore IVs, and I'll place the blanket on him for warmth.
Is there anything else that you would do for your patient?
Yes, if time allows, I'll go ahead and do my detailed assessment and monitor my patient, and that's it.
Begin the station by indicating that the proper personal protective equipment is being used. Before beginning the assessment, size up the scene to determine that it is safe. Gather other information about the incident and consider the need for spinal precautions. Once at the patient's side, use the initial assessment to get a general patient impression, determine responsiveness, and determine the patient's chief complaint. Use the initial assessment to also identify and manage any immediate life threats affecting the ABCs, airway, breathing, and circulation. Complete the initial assessment with a quick check for any major bleeding and assessment of the skin. Then manage shock and identify priority patients for transport. With the initial assessment complete, perform the focused history and physical exam, or the rapid trauma assessment. The rapid trauma assessment is used if the patient has a significant mechanism of injury and possible critical injuries. Begin at the head and proceed to check the major areas of the body using the mnemonic DCAP BTLS. DCAP BTLS stands for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling.